Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan of the Allegheny County Health Department, here to give our weekly briefing on COVID-19, the pandemic. We continue to see the numbers improve, which is very heartening to see. So many people have continued to be cooperative and wearing their mask and socially distancing and the things that Dr. Bogan and our experts at the state, federal, and across the board in our health community advises. So that's the good news. Other good news, we're starting to get more and more vaccines out there, and Dr. Bogan will talk a little more about that as we continue her briefing. And we're doing everything we can to try to get as much as we can to people, and how, the challenge we all have in trying to get the vaccines. We know hopefully in the next couple of weeks, by the end of the month, the J&J vaccine will come on board and be approved, and that will add more product to the vaccine supply. I wanted to just, before I introduce Dr. Bogan, I don't normally do this, but there was a really good article today by Gene Collier. Gene's one of the best writers, one of my favorite writers, and does a great job and really brings home an individual case and what it really means. And in today's February 10th article, he highlights a woman named Stacey Graham, whose mother, Sandra Lynn Manning, succumbed to COVID just in the last week. And I'm going to read directly from it because I couldn't do it better than Gene does. And I won't read the whole thing, but just quoting about Sandra Lynn Manning from her daughter, Stacey Graham. Quote, age 79 of Carnegie, PA, died unnecessarily due to COVID-19. A direct result of some people's refusal to wear a piece of cloth over their nose and mouth in order to protect others, especially our older loved ones who we know are more at risk. The result is millions of people have died when it wasn't their time. Sandra was a vibrant 79-year-old with more life ahead of her and more love to give. It was crazy, said Stacey. She died Monday, the 1st of February, Stacey said. The previous Friday, she said she didn't feel good, lying on the couch all day. She lived by herself, so my brother and I went over, made some toast, bundled her up. The next day, the same thing. Wasn't severely ill, mild fever, nauseated. Sunday, she woke up really ill with a severe sore throat. I took her to Walgreens to take the COVID test. Sandra got weaker through the day. Stacey called the hospital and was advised that if her mother wasn't having difficulty breathing, she didn't have a high fever, she should be kept at home where she was comfortable. I went down to sleep on the couch for a few hours after I got her settled in bed, Stacey said. And when I woke up a few hours later, she was dead. These stories, we talk about figures, case numbers, fatalities, hospitalizations. When you personalize it and talk about this woman, like many others who are age 79 or 80, we know our seniors are very, very much at risk. The story goes on to say, Sandra stayed away from people, did everything she could, but Sandra allowed herself a dinner with her son at a restaurant the week before she died. We don't know how she got it. I'm sure they'll do different testing and things like that. But it drives home the point, as Dr. Bogan says, please keep wearing your mask. Please keep socially distanced. Please be responsible and protect our seniors and our neighbors and our friends. So hopefully, again, we'll get the vaccines in people's arms, get people protected, but we're not there yet, but we still got a number of weeks and number of months ahead. So let me turn it over now to Dr. Bogan, and she'll give her weekly report. Dr. Bogan? What's that? Oh, okay. I did forget. I did neglect the thing we're reporting. One of the things Dr. Bogan wants to make sure is as the county fills in gaps, so to speak. We know our hospitals, we know our healthcare facilities, we know our pharmacies are doing certain things, but the county is also, in addition to our Monroeville location, going to be going out to senior buildings, senior high-rises throughout the county. And there's obviously a number of them, I believe over 170 that we have identified thus far. We're beginning today in Homestead and in Clairton, and over the next few days we'll be doing Homestead, Clairton, West Mifflin, Turtle Creek. to make sure that people that aren't in long-term care facilities and aren't working in hospitals, et cetera, are still able to get covered, because we do want to make sure, particularly in our vulnerable communities, that they also are getting vaccinated as we need that to happen. So, Dr. Bogan, let me turn over to you and give your weekly report.
Thank you, County Executive. So, good afternoon. Thank you again for joining us. I am pleased that the case counts in the county continue to decline. Our positivity rate remains at 6%, and our daily case count is about 200 a day. But as I've said in the past, I remain cautious. We've seen how quickly this virus can spread if we drop our guard, especially with these new variants that appear to spread more easily. So this week, the Pennsylvania Department of Health notified us that they had detected the UK variant in a sample sent for testing from the Allegheny County. The Allegheny County Health Department completed case investigation and contact tracing with this person and learned that this person does not know how they contracted the variant. This is the first and only case of the variant reported in Allegheny County thus far. I suspected that it's been present in the county for a while. This news reinforces the need for us all to double down on the efforts we're taking to control the spread of the virus. Wearing masks that are properly fitted, keeping at least 6 feet from others, limiting trips out of the house and situations where you're around others, washing your hands frequently. All of these steps can protect you and others from COVID-19 and the new COVID-19 variants. Part of the strategy of containment is continuing to test for the virus and following isolation and quarantine protocols. The health department continues to offer testing throughout the county, and the McKeesport test site remains open with plenty of availability for appointments. Now on to vaccines. I've reported to you each week that vaccine supply remains our biggest challenge and our biggest barrier to vaccination, and that has not changed. We still have that as our main barrier. The vaccine supply to the state and to the vaccine providers across the county remains very limited. Of the supply that has come into the county as a whole, only 11% of those doses have come to the Allegheny County Health Department to distribute. As the county executive just mentioned, we are excited to announce the first steps in providing vaccine right to seniors in their living facilities. A team from the health department, the Department of Human Services, County Emergency Services, and the County Housing Authority, and volunteers from the Medical Reserve Corps delivered the first doses to residents in a housing authority buildings in Homestead today. The team went to the buildings earlier this week, handed out information about the vaccine and registration, and today they registered people on site and distributed the vaccine to those in the building. And again, it was only open to those who live in the buildings. Based on the supply of vaccine that the health department receives from the state, this team will provide vaccine to seniors at county housing authority buildings throughout the county. We started with county housing authority buildings because we already have a strong relationship with them. And this is really a pilot program that we will expand to other low-income, standardized senior living facilities, subsidized senior living facilities as the supply of vaccine allows. And it won't solely be the health department vaccine. We're already working with other vaccine providers in the county to collaborate on providing vaccine to these facilities. The collaboration will work with housing authorities, landlords, building managers across the county. As I've said before, the health department's primary role in vaccine distribution should be to fill in the gaps. And they worry that these seniors could fall into gaps. These facilities were not part of the federal partnership with CVS and Walgreens that provided vaccines to long-term care facilities. We know that seniors in general are less likely to have access to computers or to the internet to make an appointment, or the transportation needed to get to an appointment. By bringing vaccines directly to these seniors and eventually the thousands of others living in low-income subsidized facilities, we are addressing this important need in our county. The statistics are staggering and they're worth repeating. Across the country, 8 of every 10 deaths due to COVID-19 are among those 65 and older. In Allegheny County, that number is higher, 9 out of every 10 deaths, and about 6 to 7 out of every 10 hospitalizations for COVID-19 are among those 65 and older. This initiative to reach seniors where they live is just one of the county's part of the county's vaccination plan. As the supply of vaccine allows, more large-scale vaccination clinics will open around the county. My goal is to have clinics in the north, south, east, west, and center to make sure that people don't have to drive across the county to find a vaccine. The health department will also coordinate with community partners to bring vaccine right into communities in need. Planning for these clinics is ongoing. I want to remind you that it is normal to feel sick after receiving the COVID vaccine and other vaccines. Common symptoms after the COVID vaccine are soreness or swelling where the shot was given in the arm, fatigue, fever, chills, and headache. The CDC launched a program called vSafe to provide personalized health checks after you receive a COVID-19 vaccine. It is a smartphone-based tool that uses text messaging and web surveys. Through vSafe, you can report to the CDC if you have any side effects after getting the vaccine. And depending on those answers, someone from the CDC may call to check on you. And vSafe will remind you to get your second vaccine dose if one is needed. So I encourage any of you who've gotten the vaccine or getting the vaccine to please register for vSafe. Just a few reminders. The McKeesport site and the health department's mobile van units will remain on shortened hours this week because of the weather. Testing begins at 11 a.m. at these sites. Hours at the Monroeville Vaccine Clinic have not changed. All testing and vaccine sites will remain open on Monday, President's Day, although our health department offices will be closed. So thank you for your time. Please stay well and be kind.
The first question that we have today is from Public Source. Many grassroots collaborative efforts are springing up across the county to help eligible residents obtain a vaccine appointment who lack the technology or time commitment to search for an open slot, including several specifically targeting at helping marginalized communities such as the disabled, immigrants, and Black, Indigenous, and people of color individuals. Does the county have any plans to prioritize access for these underserved groups, or any plans to centralize and streamline the appointment process so that it is more accessible?
So we definitely hear the frustration that people are experiencing making appointments. We did implement phone calls through 211 to schedule for appointments as a first step, and we continue to refine and revisit our processes to improve access. We have, again, had some community outreach work, and we're working in the senior buildings as part of that effort. We will continue to work with community partners to really try to address access issues that have been raised. But again, it is a process that is ongoing, and we will continue to learn and to modify as we go through this process together.
This next question is from WTAE. Dr. Bogan last week said she was looking forward to a Johnson & Johnson vaccine possibly hitting the market. Given some of the data surrounding its overall efficacy and lack of strength against some of the variants, can you talk about your feelings on the vaccine, what impact a third vaccine could have on overall supply, and if the county has received any indication of when we may see it here if it's approved by the FDA?
Yeah, so the Johnson & Johnson vaccine, the data have been sent to the FDA for review, and my understanding is that there is a meeting of the FDA group that reviews that at the end of February. So after that meeting, we'll learn more about when it would be available if it's approved. I want to remind people that the studies that have been done on COVID vaccine look at different outcomes. The main outcome that all the vaccines are compared against is the outcome that looks at whether you have symptomatic disease with a positive PCR test. So that means you have to have positive PCR and you have to have a couple of symptoms of COVID-19 to be counted as sort of what is called a case in the studies. And they compare the cases in placebo to the cases who got the active vaccine. And that outcome is the 94 and 95% with Pfizer and Moderna is for any symptomatic positive infection, and for Johnson & Johnson, it's been reported to be about 66%. However, if you look deeper into the data, the Johnson & Johnson vaccine was 100% effective at reducing hospitalizations and death. So it depends on what measure you're looking at. It's an excellent vaccine at preventing hospitalization and death. And so that means it's a great vaccine. And when we compare it to, say, influenza vaccine, again, doesn't prevent 100% of infections by far, it doesn't do that, but it does reduce greatly the risk of hospitalization and death from flu. So the J&J vaccine is just one more vaccine in our toolbox. It's a single vaccine. It's shipped in standard ways. It doesn't require any special handling. So because of all of those benefits, I think it is part of a great, will be of great use. We don't know when we'll get it, and we don't have a lot of data yet on the variant and its impact with variants. So those data are still emerging. So we'll have to just wait and see.
This next question is also from WTAE. Mayor Peduto sent a letter to the governor asking to put teachers at the front of the line for vaccinations. Does the county feel this urgency? And is there something that the county could do to get teachers vaccinated quicker?
Well, the urgency is really for as many people as we can have it. We know teachers are, obviously important, and getting kids back to school and et cetera is important. So as Dr. Bogan has said, the guidelines right now are talking about people over the age of 65, because as she indicated, 90% of the deaths here in Allegheny County are for people that are over the age of 65. So they are going to be the priority and have been going forward from the state, from the federal government, et cetera. But there are many other groups that we want to make sure when we get the robust product, the number of products out there, a lot of it quantity-wise, that it can go to folks like our school teachers and others who are in those type of jobs. So again, they've laid out who is most vulnerable right now, and I understand the mayor certainly is advocating for folks in his city and in his community, and those are difficult decisions that the governor and the Secretary of State, the Secretary of Health at the state level have to implement.
This next question is from the Tribune Review. Does or will the health department have any vaccine services for eligible individuals who are homebound and cannot travel to a pod? What advice do you have for people in this scenario?
So those plans are, I think I was asked this question last week, and we are continuing to work on plans to meet the needs of various groups, including homebound. Those plans aren't finalized and aren't ready. But I do think that people who are homebound, who get services, should be in touch with their healthcare provider and with their health insurer to see what plans they have as well, which to find out, again, if they get home care services, is that a way that they can also get vaccine? But I will, as our plans become more robust, we will be sure to share them with you.
This next question is from Public Source. Given the vaccine rollout and the decrease in the transmission of the virus since late last year, has there been a significant decrease in COVID hospitalizations in the county recently?
Yeah, our hospitalizations have been declining pretty steadily, and if you look at the state dashboard, you can follow those trends over time. But yes, our hospitalizations are down.
This next question is from WTAE. The CDC said today that double masking can be really effective. Would you advocate for double masking? And are there any best practice recommendations if someone wants to double mask? The CDC has put out some information about double masking. As I have said repeatedly, I feel like perhaps a bit of a broken record, that masks are best worn if they fit properly, that is tight fitting, that they have like a little clip across the nose to really keep the air in. Double masking does improve that. It depends on what they are. So the CDC has a link that sort of has pictures and shows how to properly double mask. So for instance, if you have an N95, you don't need to double mask. If you're wearing a surgical mask, you shouldn't do two surgical masks, but you should do a surgical mask and one that holds that in place. So again, I refer you to the CDC website that has beautiful pictures that show sort of properly fitted masks, ways to check on it. And generally, again, we are pretty adherent to the CDC guidance here. So again, what I care about most is that people wear masks. Everybody should be wearing a mask out in public and in buildings, et cetera.
that the better fitting they are, the more effective they are.
This next question is from the Pittsburgh Business Times. Now that we have seen the UK variant here in Allegheny County, could you talk a little more about what the strategy is going forward to address this or other variants, and to keep it, how we will keep it from causing another peak, and how that impacts the vaccination effort?
We know that you can prevent the spread of this infection through proper mask wearing, through hand washing, through physical distancing. Those don't change. We just need people to follow them and be really attentive to know that, again, these variants, if you're not doing those things, will spread more effectively and efficiently. And so I just ask everybody to double down and do things properly, so we don't have that next peak.
This next question is from the Tribune Review. Has the county seen any increase this week in its allocation of vaccine doses?
We have not.
And this final question is from WTAE. Can you please give a flu season update for Allegheny County? So not COVID.
Oh my gosh, I got a non-COVID question. That's awesome. It's been a long time. So the flu this year has been really, really low. We've had 151 positive flu tests in Allegheny County this year. That is less than we normally see in the first month of flu, so that's great. We've had 3 hospitalizations that we're aware of and no deaths. And again, flu is a respiratory virus. And the fact that we're all wearing masks and washing our hands and not going out as much, I think, has not only contributed to slowing the spread of COVID, but it's also reduced other respiratory infections, including influenza. So it has been an extremely mild year for influenza. And we expected that because that's what happened in Australia this year as well, that other places that precede us each flu season also had much lower rates of flu than in prior years. Thank you for a non-COVID question.
And that was the last question, if there's any closing remarks.
Thank you, Dr. Bogan, and really, again, thank you for the great service and the work of your whole department, and week after week after week, day after day, making sure we're staying safe, giving us the good advice that we know will help keep our families safe, help keep our community safe, making sure we get as much vaccine as we can and get it out to people, people most in need. And the fact that we are seeing our hospitalizations come down is a good sign. The case level keeps coming down, but it only happens when people are cooperating and people are wearing their masks, wearing them properly, and also keeping distancing and doing all the things that we need to do. So many organizations, so thankful that have come forward to volunteer and to offer their facilities, their personnel, to do everything we can. So it's really been a community effort. We still have a ways to go. But I'm sure, if we continue to do the things that our experts tell us to do and advise us to